Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World. You know, when a cough is more than a cold or the flu, in December may trigger peaks of cold and flu season, but symptoms such as coughing, fatigue could be signs of something else. These symptoms could also be due to a progressive and chronic condition called NTM. Well, to spotlight this serious and often overlooked condition, Dr. Julie Philley from the University of Texas Health and Philip Leitman, president of NTM Info and Research Incorporated, will share not only their experience with us and their perspectives on NTM, but also they'll be talking about the risk factors and symptoms to be aware of on this disease. And, you know, I just got over this major bronchial condition for 2.5, almost 3 weeks. I thought I wanted to die. So I went to my doctor immediately because I had no idea what was going on. But there's so many seniors and there's other people that have other lung diseases. And my question, and I want to welcome you to our show, Dr. Julie, tell us, and Dr. and Philip, what is NTM lung disease and what are the symptoms actually?
Thanks for having us, Kathryn. NTM is more than just a big word, but it stands for non-tuberculous mycobacteria. And it's a type of a lung condition that actually is caused by bacteria that are common in our environment. So we're all exposed to these bacteria, but it can cause significant symptoms in some individuals. These symptoms may include cough, they may include weight loss, fatigue. Some people may even cough up blood. But what we do understand is that we're seeing more of this. That's why we're here to talk to you today, to increase awareness that as many as 100,000 people may be diagnosed with this in 2018, and we're seeing more cases at a rate of more than 8% a year.
You know, it's amazing. A friend of mine who's in her 80s, right, she got something, and it may be this. And for 8 months, she had it for 8 months. She was coughing up blood. She was doing all kinds of, finally, this one doctor recognized what was going on with her, and she's much better today. But it went on and on and on and on, and it was unbelievable. And they did all kinds of different tests and everything else. Where are people likely to be exposed to NTM, Dr. Julie?
That's a great question. And I alluded to this earlier, but these are bacteria that we live with. We live around these bacteria in our environment, but they're found in water sources and in the soil. So water sources, things like your shower head, things like your sink faucet, they can be found in hot tubs and probably in all types of mist. We can sometimes culture these types of bacteria, and they're common around places that have lots of water. They're also found in potting soil and other types of soil sources. So fortunately, they don't make the majority of us sick, but some people that are at risk, they can become ill from these bacteria.
Can it be also a cough, somebody coughing near you or touching you after they've done the potting soil?
No, these bacteria are not thought to be contagious, and so you don't have to worry about catching this from a neighbor that's coughing near you, although I do recommend you take other risk factors because it is cold and flu season. But these bacteria are not contagious. They're inhaled probably through a water or soil source, but you cannot catch them from your neighbor or your family.
You know, who is most at risk for NTM lung disease, Doc?
The people that are most at risk for this type of lung infection are people with underlying lung disease, and some of those types of conditions may be things like COPD or other types of less well-known conditions like bronchiectasis. Other people with weakened immune system are at risk to get these types of infections. We also understand it's more common in women and it's more common in older populations.
Okay. And why is it so important to get tested for NTM lung disease?
Well, just like your friend, I think it's so important because the symptoms can be debilitating. This cough that won't go away despite multiple antibiotics and weight loss can really affect one's life. So the reason to be tested in early treatment is to feel better, but also because we understand that early treatment and diagnosis of this infection can actually prevent lung destruction in the future.
You know, I want to ask Philip. Welcome to our show, Philip. How are you today?
Great, thank you.
Can you tell us a little bit? It's because of your wife that you really got involved with NTM. Am I correct?
Yes, you are. My wife had a delayed diagnosis because the docs at the time, back in 1996, weren't sure what to look for. It wasn't as well known. She had repeated treatments and cough kept coming back. She had the night sweats, weight loss. Finally, somebody diagnosed NTM because they thought about it. It's a simple diagnosis. You're checking what you're coughing up in the sputum, and once you have the test, you can determine what it is and then figure out a better protocol, which extended her life. But we got started because my late wife, Fern, saw other patients when we went for her to get treatment that didn't understand the disease. And so she said, let's develop something to help them. So we developed a website that, from a patient's perspective, ntminfo.org. And there's another great website, aboutntm.com. And those sites will give patients a lot of information. If there's a key message I would like to give, it's if a patient is coughing and it's recurrent and coming back, ask your doctor about NTM. Ask your doctor if he or she will check for it, because if you find it, it's going to help you get treated sooner if you need that treatment and have a better outcome. That's why we're here.
Let me ask this one question. If your doctor most doctors are aware of this disease, correct?
I think this is becoming on more and more physicians' radars. So more and more people have heard of this, but one of the major reasons that we're here today is to promote that type of awareness so that there's this low suspicion to be tested and to test patients for this so that we can make this early diagnosis to help people.
And I want to ask you, Philip, thank you, doctor. I want to ask you, Philip, can you tell us how your wife's experience with this type of lung disease impacted you as a caregiver, and how long she's passed away? Am I correct?
She did. She passed away in 2014, but she was diagnosed in 1996. At the time, she was severely ill, and the conversations with the doctors were that maybe she could have 18 months to 2 years. That wasn't acceptable. It wasn't acceptable to lose her within a couple of years of diagnosis, and we didn't. She lived quite a long time after diagnosis, and she did so because we sought expert treatment. She took the medications that were required, did all of the treatments that were needed, and had a tremendously positive attitude. So I was very frightened. I didn't understand what was going on. But in a way, not in a way, in fact, this enhanced our life. Terrible to think that you're dealing with such a severe illness, but it brought us even closer together. It allowed us to focus on a life and death matter together. Watch our family grow, our children graduate from university, grandchildren born. What a blessing. And it's because we got the information, got the expert treatment. So there's no season for NTM. It can be diagnosed at any time of the year. It's not related to getting a cold. It's important for patients who have the symptoms to seek out treatment or seek out a diagnosis. And we want doctors to think about it if patients keep coming back. That's what the motivation is.
Doctor, there's no age that, or is there a specific age that people more readily get NTM, or it could be anybody that he has COPD or whatever, correct?
We do see it in younger populations, and again, people that have other types of lung conditions can be at risk to get this. But typically we do see it in older populations, and these people can often be very healthy. So it could be someone without any underlying or any medical problems that just has this cough that won't go away. And so we really have a low index of suspicion, as we say, or we have this idea that we really need to have this on our radar so that we don't miss these types of cases.
Okay, the other question is, what is the test? Can you tell me, doctor?
Sure. It's very simple to test for NTM. You cough up a sample, you put it in a cup, we send it to the laboratory, and we can look for these types of mycobacteria. I will say that sometimes we need to test people several times, their sputum samples, and there's often other tests that need to be done at the discretion of the physician that's treating the patient, but in general, the tests are very simple to look for this type of a disease.
And let me ask this question. How long does it usually take once you start giving them the medication for them to see, a major difference?
Well, this disease is treatable, and each patient requires a specific drug regimen that's tailored to them. And you have to take into so many different things into account. It's really important to seek treatment and to discuss that with your physician.
Right, so it's not contagious, we know that. And so what are some of the risk factors and, the other symptoms that we may be looking for besides coughing and fatigue? What would be, besides, spitting up blood, whatever? Is there other things?
Well, occasionally we'll see people with just simple weight loss that also accompanies the cough and the fatigue and the weight loss. The coughing up blood that you had mentioned. That can occur with this infection. As far as risk factors, again, thinking about people that have had repetitive or recurrent infections, either dealing with the lungs or dealing with the sinus tract, that may give us a clue that this is indeed what is causing their symptoms.
And Philip, may I ask you, when did you become president of NTM and research and info and research?
Well, we formed it as a not-for-profit organization in 2002. We launched as a website, had tremendous response, and so Fern and I were sitting literally at the kitchen table with this and decided to do more so that we could respond to emails and try to get education and awareness started. So then we made it a 501c3, rented office space, and literally there's just a few people. But
wow.
We're working with patients all the time. What an honor.
Wow. And how long did you have to, as far as the caregiving part of it, how long did it take for her to recover to not be so ill?
Her case was at the far end of the spectrum. She was very ill. So it took about 3 months, initially 2 months in a hospital. We traveled to Denver, and then another month at home. After that, she had a very good quality of life. We continued to do therapy for airway clearance, give her the antibiotics, and there were exacerbations from time to time. But for most of the 18 years after her diagnosis, her quality of life was very good.
Wow. Can I ask how old she was at the time?
Of her passing?
No, not of her.
The diagnosis, she was 50. We believe, though, that she had it quite a bit earlier and wasn't diagnosed for about 6 years.
So when I asked that question about, is there ages that, it could be any, it could be a young person, or it could be somebody that's a senior who has had lung problems before. Am I right, doctor?
That's right. I think it's just always important to maintain that thought in your head that you need to understand why people have these symptoms, especially when they don't go away. Early diagnosis is key here. Absolutely. Tell your doctor you have all of the signs and symptoms, and the best way to educate yourself or the easiest way is to go to a couple of websites that we recommend. One is aboutntm.com, and another website is ntminfo.org.
I want to thank you both for joining us today. This is really an important issue to get out there as soon as possible, because right now we've got a little bit of snow on the grass. The weather is changing rapidly, and this is what happens when people get sick and you may not be able to tell. Thank you both for your service. I hope you have both happy holidays. And this will be on all of our TV stations, and we'll be able to convert it over to a radio show too. How about that?
Oh, thank you so much for having us.
Thank you.
And thank you for joining me today on Kathryn Raaker's World, and Let's Just Talk.